Hello, my name is Michele DeGraw, adult nurse practitioner at Stony Brook Cancer Center. I specialize in gastrointestinal cancers, and today we're going to talk about symptom management for gastrointestinal cancers and different treatments. There are a lot of different kinds of gastrointestinal cancers, but first we'll talk about the gastrointestinal anatomy. Our gastrointestinal tract starts from our mouths and travels all the way down to the anus. This is where food is digested and processed. And we have a bunch of different types of gastrointestinal cancers, most commonly colorectal cancer. Another type is pancreatic. We have gastric and stomach, gastroesophageal, neuroendocrine tumors, liver cancer, gastrostromal tumor, also known as GIST, and gallbladder cholangiocarcinomas. A lot of times the symptoms of gastrointestinal cancers do not present themselves, but when they do, people have reported feelings of abdominal pain, nausea, vomiting, fullness and bloating in the upper abdomen, heartburn and digestion, poor appetite, unexplained weight loss, persistent bloating and distension, and blood in the stool. But again, many times these symptoms do not present themselves. This is why screenings are so important. The gold standard of gastrointestinal screening is the colonoscopy. The colonoscopy is not a surgery. It's essentially a procedure that you are sedated, you're prepped, and a scope is put down through your lower GI tract and looking for abnormalities. And at the same time, they can take resected tissue, remove polyps, and biopsy and look for further pathology on these abnormalities. There are other screenings that are also available, such as Cologuard and some blood work, but the gold standard is colonoscopy, and it's recommended to start doing those at age 45. There are many different ways to treat gastrointestinal cancers: chemotherapy, surgery, precision medicine, or targeted type therapy, such as radiation or immunotherapy. Many times we use a combination therapy, which may include chemo and surgery, or surgery followed by chemo, or chemo and radiation, and similar treatments may be used for each kind. Chemotherapy is a powerful medication used to treat cancer. The goals of chemotherapy are to shrink or kill cancer cells and tumors and prevent cancer from spreading. Combination therapy uses at least 2 different medications or treatments to treat cancer. There are many types of chemotherapies available, and whatever is appropriate for the type of cancer is matched up by biopsies and pathology. Clinical trials are also important for treatments because they're ways of identifying new and effective treatments for many different kinds of cancers. The side effects of chemotherapy are a major part of your treatment. A lot of them could be prevented, especially nausea and vomiting, by giving what we call pre-medications prior to chemotherapy. There are also therapies that are given at home to prevent and treat side effects. Some of these side effects happen during treatment, but most of them happen within several days after treatment is given. You will be prescribed antiemetics or anti-nausea medication from your doctor, and they will be taken at home at the first sign of nausea. The key is to catch any side effect early and intervene early because they do not go away on their own. Most common side effects of chemotherapy, as most people know, are nausea and vomiting. When it comes to gastrointestinal cancers, a lot of the side effects also include, but are not limited to, dry mouth, mouth sores, nausea, vomiting, diarrhea, constipation, headaches, and probably number 1 would be fatigue. Many of these side effects can be treated at home, especially if they are intervened early. Here are a list of some of the common side effects of chemotherapy, which we reviewed: nausea, vomiting, diarrhea, constipation, lowers your good blood cells as well as bad blood cells, which could cause neutropenia or anemia, or thrombocytopenia, which is low platelets. Fatigue, mouth sores, neuropathies, which is a numbness and a tingling in your fingers and toes that could come from some of the chemotherapy treatments. Hair loss, and problems thinking and remembering things, which is commonly known as chemo brain. This is a review and a diagram from the National Cancer Institute showing some of these side effects and how they can often be intertwined, and often people have more than one side effect at a time. Very important to manage the side effects as they come. Unmanaged side effects could lead to a multiplicity of different issues. It could lead to hospitalization due to dehydration or neutropenic fever or delay in treatment, which is never ideal. It's very important to be aware of the serious side effects of chemotherapy. Unfortunately, chemotherapy kills good blood cells along with the bad cancer cells. Some of the cells that are killed during chemotherapy infusions are your red blood cells, which could cause anemia. A lot of times you could get a blood transfusion to correct that. Also, thrombocytopenia, which is low platelet count. Without our platelets, we are more at risk for bleeding. And our white blood cells, which are our immune system, often get lowered with chemotherapy as well. The neutrophils are the part of the white blood cells that fight bacteria. So oftentimes, if their white blood cells or neutrophils are too low, the chemo will be held and an injection may be given to raise those white blood cells. There are medications used to prevent neutropenia also, like Neulasta, and that's something you may get along with your chemo regimen. Patients that are neutropenic are very at high risk for getting an infection, and this is called an oncologic emergency. Any fever of 100.3 or greater when neutropenic must go to the emergency room at once. Some of the other serious side effects, which we did discuss, is fever. This fever could be an indication of a serious infection from having a lower immune system, which puts you at very high risk for sepsis, which is an oncologic emergency. Sepsis happens when an infection triggers a chain reaction throughout your body. Sepsis can rapidly lead to tissue damage, organ failure, and death. There are a list of options to treat side effects such as hydration, nutrition, physical activity, home medications, and supportive care. We will go through each of these things. The key to treating and preventing side effects is to keep your body very well hydrated every day that you're receiving chemo, not just on chemo days, but even between cycles. So maintaining excellent hydration, the people who are excellent hydrators are the ones who tolerate their chemo better. And nutrition is also an important factor. Even if large meals aren't an option at the time of treatment due to illness, we recommend small, frequent meals. Remaining physically active is also important. Continuing activities of daily living, light exercise, and just remaining active. Most people still work their regular jobs while getting chemotherapy. There are home medications, which we had earlier discussed, anti-nausea medications, antidiarrheals, stool softeners. All of these things should be kept in the house while on chemotherapy in case needed. There are many other options for supportive care as well. I like to hydrate my patients at the end of their cycles or in between chemo cycles to help them maintain their hydration during their care. Now, going back to hydration, it is one of the most important things that you could do for yourself during your treatment. It is recommended to drink close to 64 ounces a day. These can include fluids like water, juices, electrolyte beverages are best, such as Smart Water or Propel or Gatorade. Always avoid alcohol and caffeine intake. Caffeine may be limited to 1 cup a day, but those usually counteract hydration. Being well hydrated limits and minimizes side effects. It's important to talk to your doctor if you're having difficulty maintaining hydration on your own and unable to drink sufficient amounts. This is where we could bring you in between cycles or during cycles to hydrate you intravenously. Nutrition is very important to maintain during your treatment of chemotherapy. The goal is always to maintain a healthy diet. Protein is vital, so even if you only do small frequent meals or snacks in a day, protein is important to have and high calories. Nutritional supplement shakes are also helpful. If appetite is poor, you could supplement with insured beverages or protein drinks. If taste bud change is a problem, you may be able to focus on just keeping high calories and high protein. There are also always other ways around that as well. Your oncology team can offer suggestions to stimulate your appetite if you become completely depleted. There are certain medications that can help stimulate appetite, which can be discussed with your doctor. Physical activity and maintaining that is also important. Even if you're not a very active person on a daily basis, it is important to maintain your normal activities of daily living. But you should also listen to your body and rest when you need to rest. If you exercise normally, you could start light and see what you could tolerate. You could discuss these exercises with your oncology team to see what's appropriate and what isn't. Staying social is important, but it's important also to stay smart. It's important to stay out of crowds and public places with crowds and avoid anybody who's sick or may be sick, just to avoid getting an infection. If you do need to go out, you should always wear a mask and use hand sanitizer. Home medications. Your home medications are often going to be prescribed by your doctor to help manage your side effects at home, and there are also recommendations that will be made for over-the-counter treatments. Some of the things that may be prescribed are Zofran, ondansetron, or Compazine, prochlorperazine. Those are the two main anti-nausea medications that you will have at home to use as needed for nausea. And remember, always take everything right away. Do not wait for these side effects to go away because they will not go away on their own. Other recommended medications over the counter may be stool softeners, antidiarrheals, or antacids. We often recommend Miralax, Colace, and Senna to help with bowel movements, and Imodium for diarrhea. Pepcid and things like Tums may help with indigestion and heartburn. If these medications are ineffective at any time, always reach out to your healthcare provider. There are always more recommendations and alternatives to try. Communication is very important. There are different options of supportive care outside of your doctor's office, which include acupuncture, Tai Chi, yoga, and other mind-body therapies. These can help relax you and help with benefiting a good night's sleep. Vitamins and other therapies and nutrition therapies are also available. We do not recommend any antioxidants during your chemotherapy treatment, so if you do have any interest in taking vitamins or herbal supplements, that should always be discussed with your doctor first. So these supportive care measures are in addition to traditional healing practices, such as what was discussed earlier, your medications that are prescribed and over the counter. Talk to your doctor before starting any of these things, as they may not apply to you. There are self-education resources available to patients as well. There are legitimate websites that are listed below that could help answer some questions that you may have at home. It's always important to reach out to your healthcare provider about your concerns. It is important to discuss what you learn on your own and what you learn in the office. And if you have any questions, it's important to always discuss them. This is a resource credibility checklist. These are different ways to make sure you are at a reliable and trustworthy website to find your information. There are many things on the internet that are not true. Always communicate with your provider and your care team with any questions or concerns. Write things down before going to your visits. It's often hard to remember what you're going to ask when you come in. Repeat back what the provider has told you to ensure that you understood what they were telling you correctly. And talk to your healthcare provider often and openly. There are no silly questions, and it is important to communicate anything you are feeling or anything you are unsure of. Here are some community resources that may help with different things such as handicap stickers, volunteer services, social work services, and any sort of programs that may assist in some way. Here is a list of additional community resources that you may find helpful that you could look through. Thank you so much for listening to this presentation. If you have any questions or concerns or would like to reach out to our providers, you could reach us at this number at Stony Brook Cancer Center or our website. Thank you very much.